We're joined by New York City Council member Mark Levine. He's also the chair of the Council Committee on Health. Thank you for being with us. We're seeing these dramatic steps being taken, and we're starting to see, big NBA, our NHL here in Canada, making decisions that get in front of the problem. And I just want to ask about the thinking about getting in front of it and asking people to take steps that may seem premature, but when you understand how these things kind of unfold, may not be premature.
They're no longer premature. We can either act now in reasonable ways, or we're going to be forced to take even more draconian measures down the line. We need to be acting to limit large public gatherings and to limit any non-essential events. That's happening now organically as organizers are making that decision on their own, but government needs to step up and put mandates in. I believe that will be happening in rapid order here in New York City. We have to act quickly before this gets even more out of control.
The natural resistance, of course, is we also don't want to cause economic damage or more than necessary. If we knew exactly how long this would be, it would be different. But things, Mark, like telling people not to take the subway or to stay home, even if it costs the business economically, are we there? Or are we at a point where there's pushback still on that, or there is agreement that it's just time to do whatever it takes?
Every one of these decisions has to be balanced against the costs that are known economically, and even cost in health in other ways. But we must stem the pace at which this disease is gathering steam. We can do that by social distancing. We perhaps might not be ready to shut down the subways, but we are on the edge of major aggressive steps to help people shelter at home, to telecommute, to avoid large social gatherings, and to generally limit discretionary activities that will expose them to large crowds. The time to act on that is now.
When will schools be closed?
That's a very weighty decision because of the impact on parents who rely on childcare and kids who rely on schools for food and nursing services. So I don't believe that's imminent, but it's still on the table as this crisis unfolds.
The president himself wasn't really too sure what would happen with those co-payments on treatments for coronavirus. How will we protect the most vulnerable here in New York City?
It would be outrageous if anyone was denied treatment in the midst of this epidemic based on ability to pay. We have got to get systems in place to provide this service to everyone who needs it. It's an epidemic. If any segment of the population goes without medical services, we all suffer.
How quickly, though, can you move on things like that? Those are obviously important ideals, not all at the city level, right? You need the state, you might even need the feds in some case to step up. How coordinated are the levels of government here?
Well, we have a public hospital system in New York City, which is larger than any in the country. We have assets here like paid sick leave, which other areas don't have. Ultimately, we're going to be relying on the federal government. We're going to need an injection of resources for healthcare provision, to compensate for lost wages, to shore up small business. This is going to not just be a public health shock, it's going to be an economic shock for New York City and obviously beyond.
What are you seeing in terms of testing? Because we continue to hear these conflicting reports. We heard Secretary Azar saying there's a surplus of tests and Governor Cuomo saying that's not true.
It's a very chaotic situation right now, at least in New York City. There's conflicting guidance coming from medical providers about who should be tested. There's certainly still a shortage of capacity, despite what we're hearing from Washington. That needs to be ramped up immediately. But I also want to make it clear that everyone who feels a little bit ill or maybe is worried they came in contact with someone who has this virus should not be tested. That will overwhelm the medical system. It could break the medical system. We need to reserve testing capacity and medical capacity for the people who are truly sick. Others can shelter at home, they can self-heal and seek emergency care if needed, but we're going to start to have to prioritize who can get service from our medical system.
How long do you expect all of this to go on? Do you have any kind of council level estimates?
The city's health commissioner is estimating a tapering off by September. But this depends on so many unknown factors, the impact of the seasonal change, and how much we can flatten the curve. Are we facing a short, intense spike, a surge in cases, or through this kind of social distancing, can we spread out this epidemic over time? That's preferred because it gives the healthcare system the room to deal with the influx of cases over time. But this is unlikely going to pass in a matter of days or weeks. I think we need to prepare for a long haul.